So I'd really just love to start with just a natural, casual conversation about your story and how you really got into mold as a practicing doctor. So let me preface the question this way. Before you experienced mold, were you treating mold? Were you seeing people with mold illness that you were treating?
I almost certainly was, but I didn't recognize it until I had the experience myself. So I thought back on some patients from when I had my family practice. But no, I had no ability to treat mold patients because I had never been taught anything about it. So it was all a very steep learning curve
So
for me.
nothing in your medical curriculum or history or medical school really ever prepared you for mold.
Nope. Maybe some hay fever, allergies, things like that, but not for the extent of what we see in our mold exposed patients. Absolutely no preparation for that.
And so would you just say that that's a big glaring hole in training in today's day and age?
It would. When I had my training, absolutely, I would say that was a big hole. I cannot speak to what medical students are being taught or other healthcare, trainees are being taught currently, but I I didn't have any experience with it and didn't even know where to look initially when I went through this in 2006.
So tell me a little bit about how you stumbled into it. I know you have a strong story of exposure.
Yeah, it was around May of 2005. I felt a little off and had a sore throat and took my temperature, and it was about 101.5. Then I started to pay attention to that. And since that's a fever of unknown origin, I worked with infectious disease specialists, ultimately saw about 18 different specialists because mold illness affects the whole body. And so this started. Other family members had symptoms, and I was hit the hardest because I had exposure both at home and at work, and I didn't know that. So we had our daughter was 5, and she would get fevers, but I was completely at a loss for what was causing this. I had read everything that was available to read at the time. We were searching down, rare viruses, and I had a bone marrow biopsy. Cancer was continually being evaluated and ruled out. I had a dozen CAT scans, about 3 MRIs, and 2 hospitalizations, and really was not any closer to figuring anything out. It actually, the moment it became clear was a day when we pushed a bookshelf to the side and saw a big black splotch behind it. And that was the beginning of us getting better. So that was the moment where we knew that we'd had mold exposure and started to learn initially for the health of myself and my family, eventually became trained, and now I get to take care of patients who are in similarly stuck situations where nobody knows what's going on with them. They haven't had a lot of satisfaction from traditional evaluations and treatments. And it would be great if, with this documentary or whatever you're doing, if we could pop this on people's radar a lot sooner. That's clinicians and patients.
Yeah, I couldn't agree more. What would you say? I'd like to know a little bit more about the symptoms that you started having. You mentioned fever, but could you be more detailed about some of the earlier onset symptoms that you were experiencing that might also help patients who or people who aren't aware even of the potential possibility of what the symptoms of mold exposure might be?
Oh, absolutely. First off, I'm going to say it's human nature to just suck things up and try and keep going. That's just what we do until we can't anymore for most people. So, what I was experiencing, vertigo, really pronounced. When I dictated at the end of the day, I had to close my eyes because it was I couldn't focus, I couldn't look and dictate. That was worked up extensively. Really bad muscle aches at the end of a day, just extremely sore. Digestive symptoms, heartburn, constipation, fatigue, which I attributed to the fevers, but it could be very hard for me to function. Neuropathy symptoms. I had neuropathy symptoms. I had a skin lesion that developed and had it biopsied, and it was identified as leukocytoclastic vasculitis, which is just weird. It That particular skin biopsy was later tested and was found to have very high levels of ochratoxin and some aflatoxin, but that was about a year later. So, I'm trying to remember. Practically every organ system was affected during the time I went through that. And I had no way of figuring out how to get out of it. And I think because I had the fevers, they could measure that objectively. I had an extremely extensive workup. Not everybody has that experience. It really depends on how they present. So fevers are actually not very common, as it turns out. I don't see it that often. Intermittent, but not like I had daily for 10 months. So, breathing, respiratory symptoms, really hard time breathing. Had the full pulmonary workup, even had a lung biopsy, and tried the normal treatments, but they didn't help, normal inhalers and things. Sinus symptoms, pretty much name an organ system, and something was going on. The skin burning without a rash, that was definitely something unusual. And taste changes. Just a normal, plain food item would taste really off. Those are things I remember experiencing.
And you had this amazing team of doctors, throwing every kind of test and, medical diagnostic tool at you. Was there at any point in any of that medical workup any insight or clue in rather to the fact that you were being mold poisoned?
Not a clue or a mention from any of the treating doctors. I was starting to hear from friends or about another physician who'd had a patient who had mold exposure, and it was just part of the many things. This was the last month or two before we figured it out. But of the actual treating physicians and even the way I had looked at it, I had explored so many other things before thinking about mold. I do want to acknowledge, though, once I figured it out, one of the people I was seeing for just general muscle and joint issues was a rheumatologist. And he must have jumped 3 feet in the air for joy when I told him it was mold, because he'd had families with this and they got better. And it was exciting to know that, this wasn't going to be the rest of my life. It didn't make any sense. It wasn't me. And, so when we finally figured it out, that was very exciting. But it is important for people to know some things get better immediately when you leave, But if you've been in a moldy environment, your body has changed and it takes time. So, I encourage my patients, if they're unclear, if their environments are bothering them, to get away for 2 weeks to, find the most healthy place they can find and not bring stuff with them and see how they feel. So that's important. And with re-exposure, people can get very sick. I inadvertently got away for 2.5 weeks, and I don't mean inadvertently, but unknowingly left a moldy house. And then when I returned to it, things got bad. That was the first hospitalization. But during the 2.5 weeks I was gone, within a day, I felt normal. It was over. Who knows what this was? It doesn't matter. And then with return to the home, really, really did not feel well. But it took me another 6 months to realize the reason for that, because it took another 6 months to discover the mold.
Yeah, it's always easier to look at it hindsight than it is, than it is when you're in it. My wife had a similar experience with mold that you did in terms of symptoms. She actually ran a fever for 18 days solid.
Mm-hmm.
And it was after we had returned from a vacation, so we thought maybe she got an infection. But it ended up being that when we returned from vacation, we had family coming into town. And so she was there was a haze on our countertops and on our cabinets, and didn't realize it was mold at the time. We just thought it was just dirty. And so she had spent several hours wiping that mold up, breathing it in, being exposed
Mm,
massively. And then for
yeah.
8 days, she had a fever afterwards. So,
Yep. I've had some histories of people like that where it's a very intense acute exposure and they can get really, really sick.